I'd like now to bring to the floor Representative Julie Johnson of Texas. Please join us, and we're looking forward to your thoughts.
Thank you, Mr. Speaker, and I want to thank my colleague from California, Mr. Garamendi, for hosting this special order hour on this very important topic. Last night, 217 Republicans voted to gut Texas Medicaid, raise costs, and take away health care from over 100,000 of my constituents, including over 80,000 children and over 12,000 seniors, just in my district. I love my state, but there are so many great things about Texas, but unfortunately, we are #1 in some of the worst ways. Texas leads the nation in the number of people without health insurance for children and adults. We lead the nation in maternal mortality, having the highest number of mothers die during childbirth, and we lead the nation in infant mortality. Over 4.8 million Texans currently rely on Medicaid, over 16% of our state. These are not just statistics to gloss over, but they are children, their moms, their seniors, and our loved ones in our nursing homes. The Republican-endorsed cuts will exacerbate Texas's health care crisis, creating irresponsible political-based policy instead of collaborating for real solutions. In addition to the loss of health care access, many of those still with coverage will see their costs skyrocket. Under the Republican budget they voted for just last night, the average premium for 103,000 people who receive coverage under the Affordable Care Act in my district will increase by 69%. Their premium will increase by 69% because of what the Republicans have done in this budget. Many families would face an even steeper consequences. In Texas 32, a 6-year-old couple with a household income of $85,000 would see their health insurance premiums increase by $13,000 a year. That's a 181% increase in just 1 year. Families cannot afford that. Now look, I am all for cutting waste and finding fraud and abuse and finding fraud, but taking away health care and making it unaffordable for the people of Texas is not the way to do it. Texas Medicaid, Medicare, and Social Security programs must be protected. They represent our commitment to the American people, that their government will be there to help them when they're at their most vulnerable. The fact is, these cuts will mean life-altering changes for the families across America. We will lead to nursing homes being closed, doctors refusing to care for patients, healthcare claims being denied, and more debt and increased costs on the backs of families who are already struggling to make ends meet. I'll ask this question to my Republican colleagues. Are you ready to take in your aging parents to care for them when your local nursing home comes? Are you ready to move your dining room table out and bring in a hospital bed because there's not a long-term care facility to take care of them? We have already lost 27 rural hospitals in Texas because of lack of adequate Medicaid funding. It takes some people in our state 3 to 4 hours just to get to a cardiologist after they have a heart attack, and you know what? They're dead. This has real consequences for people when we don't have adequate health care. This should not be a partisan issue. It doesn't matter if you're Republican or Democrat. When your mom is sick, you want them to have health care. When your baby breaks their arm, you want them to have health care. This is a universal human issue. And it is irresponsible what the Republicans have done in this budget. I'm proud to stand with my Democratic colleagues as we fight against these devastating cuts. And I encourage my Republican colleagues to join us because their constituents want health care too. Everyone does. I'm committed to finding ways to improve health care and make it more reliable and affordable. That is what Texas families want. That is what the American people want. Thank you so much, and I yield back.
Ms. Johnson, thank you so very much. Just a question, if I might.
Of course.
Talk a little bit about where your district is and we know the nature of it, but the geography
Sure. I'm Julie Johnson. I represent Texas 32. I'm from Dallas, Texas, and it is an urban district with a lot of the suburban areas. We have access to great hospital care there. However, we still have healthcare deserts. We have people that can't afford health insurance at the current skyrocketing prices that they are. They can't afford, we have very high housing costs. We have people with very high student loan debt. If you're a 32-year-old and you're trying to live the American dream and you're trying to buy your first house and afford your student loans, you can't do it all. But even worse, you know what the minimum wage is in Texas? $7.75 an hour. You're trying to do the best you can. You're working at the grocery store. You're doing things that make our economy run. You're working in retail, but you're making $7.75 an hour. You can't afford health insurance that costs you $24,000 a year when you don't even make that. And that's the problem with where we are.
I am certainly pleased that I gave you an opportunity to expand. Thank you so very, very much.
Thank you so much,
Thank
sir.
you.